Welcome back. So it is snowing outside. It's beginning to look a lot like Christmas, and I'm hoping that my kids have a white Christmas. So let's keep the snow here. But anyway, I am here for bigger things to talk to you about. And so I wanted to start with something that most practice owners never think about. We try really hard to kind of, make sure everything's running, but we don't really think about how much of that chaos that's going on behind the scenes your patients actually see. So you notice it, and your team may not mention it, but chaos isn't invisible. And to the families you serve, it's definitely not invisible. Once you understand what they're feeling, you'll see your practice much differently and jump into making some changes. So, as you know, I'm Dr. Juanita Collier, and after working with clinicians across vision therapy, OT, PT, speech, ABA, you name it, I can tell you that chaos has a way of revealing itself. Even when you're doing everything you can to keep the experience calm and professional, people can tell that you're treading water. And it doesn't make you a bad leader. It simply means your systems, your volume, and your expectations have grown faster than the structure underneath them. Let's talk about how chaos quietly reaches your patients. Patients feel your emotional bandwidth before they hear your words. And so, if you're like me, you've been in practice for a long time. I've had patients for, we'll just say, 20 years, but whatever, I carry it well, it's fine. But, they, as soon as I walk in, they're like, oh, you're having a great day, and blah, 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 you look great. And then other days, like, think I need a moment. I'm like, I don't know. Do I look like I need a moment? Maybe I do need a moment. Who knows? But anyway, patients, especially the anxious, overwhelmed ones, they pick up on your micro signals. And so I work a lot with patients who are on the spectrum or have other things going on with them. And, they're very, very observant. And so, my patients, some of them will just like walk up and give me a hug. And I'm like, thank you. I actually needed that today. So you know that they're paying attention to what's going on for you. And so they can tell just by how you're carrying yourself, your tension in your voice, if there's rushed energy. My patients are not used to waiting because I'm very like I hate waiting for doctors. I was at a primary care appointment one time and they had me waiting in the waiting room for 3 hours. I I was not very pleased with the experience, and I made that clear to them. But I hate to have my patients waiting. So my patients know that like if they're waiting, I'm like putting out a lot of fires. And so they're just like, okay, like, and they usually like give me my moment because I'm never late and they've known that for however many years. But things like that people are paying attention to. And the longer that you've had these relationships with them, the longer that you've built up these relationships with them, the longer that they see how you carry yourself in different situations. And because we do therapy, our patients see us all the time. So it's not, that annual exam. They don't, I feel like in an annual exam, I don't know since I don't really do annual exams, but for annual exams, I feel like they wouldn't really know if you're having a good day or a bad day. You can pretend to smile and everything's fine. But the patients who are seeing you once, twice, maybe 3 times a week, they know if today is a good day and if today is not a good day. So, they're just seeing you that much, which is amazing because it helps us foster such great relationships with them. But it's also, we want to make sure that like the ship is sailing smoothly so that we can come as our best selves and that our patients aren't feeling that oh, this person didn't put in this EOB or whatever is going on, and it's a whole thing. So we don't want them to know those things are happening because we want those things to not be happening because we have systems that are supporting us and supporting our practice, which then in turn supports them. We don't want that fragmented attention. We don't want any sort of subtle frustration. You're holding it together face. Like I said, these patients are seeing you all the time. So they know if something's not right. And so you might feel like you're masking it, but they feel it instantly. And if you work with kids, they feel it even before instantly. So this isn't blame. This is just neuroscience. It's just how our bodies are wired to pick up on unspoken cues. So, inconsistency is also one of the forms of chaos. So, it's not even just that they're picking something up from you, but there might be one answer from one person in your office and a different answer from another person in your office. And then they know, like almost like children, like who to ask for what they want. And so, we definitely don't want that. And so, we want to make sure that our internal processes are exactly as they should be. They know that if something is done this way, that's the way that it's done, and that's it. And that's what we want people to experience. We don't want that today is different. We don't want to feel like, oh, last week somebody told me this, and now let me double check with the doctor because they're the only person who knows the actual answer. We never want that to be the case. We do not want to be the only person who knows the actual answer. We want somebody else to be fielding those questions because we want to show up and we want to treat. We don't want to be, the head admin of the office. So, when there is inconsistency, that communicates instability. And even if the team is trying their absolute best, that's hard to kind of mask that inconsistency, because if somebody's going to say, oh, well, spoke to this person last week and they told me this, like the other person's going to be like, well, they were wrong. So it's kind of like, oh, well, let me go look into that and see what's supposed to happen. And then everybody kind of feels thrown off their game. So, what we want is we really want to make sure that patients are getting that consistent experience, and that comes from your systems and that comes from not being overwhelmed. We want to also look at the dependency patterns that become visible outside. So, like I said, if everything has to go back to you and they need to check with the head therapist or they need to check with the doctor, the decisions, the exceptions, all of those things now fall on your plate. So, when you're supposed to just be coming in and doing evaluations like, fresh, ready to go, you now have all of these other things that you need to manage first. You need to manage scheduling problems. You need to manage people being upset about things. You need to manage that this person told this patient this thing and this person told this patient this thing, and you have no idea what's happening. But now the patient standing in front of you, you're like, oh, yeah, yeah. And then you have to make a decision on the fly. And so, we want to make sure that we're not putting ourselves in that position and that chaos is not leaking into our patient's experience. And so the patients aren't like, obviously, like consciously thinking of it, but we don't want them to think in their mind subconsciously that this practice has a structural bottleneck and it's you. We don't want the bottleneck to be visible at all. We don't want them to think that everything depends on you. We don't want that to be the case at all. And remember, chaos is felt in the gaps, not in the big moments. So we're not talking about like big balls that are dropping. We're talking about like little things like, oh, I thought that you had this piece of equipment at home because that's what's written down. And it's actually not what they have at home. And then there's a whole thing. Like, we don't want that. We don't want there to be issues with follow-ups. We don't want, there to be rushed goodbyes. We want everyone who's showing up and seeing patients to be able to show up as their best selves. If there's last minute changes, missed details, everything is kind of just getting like covered up and we're trying to fix it, but families feel all of that. And so that can be the difference between somebody being like, oh yeah, I had amazing therapy versus I've had an amazing experience at this practice. You should go. And so we know that our patients are going to get better. We're great at what we do, or else we wouldn't be in practice. And so we're absolutely amazing at what we do. We can create those clinical results. But are you creating these raving fans that just can't stop talking about your practice and telling everybody that they need to go? Or are we creating people who've gotten what they've gotten because they came for what they were going to get, and that's what they expected, and then they're going to go on about their business? We don't want it to be transactional like that. We want it to be this experience, like we love it when our patients who graduated are still sending us, their report cards, or they're still bringing us in cookies because we love cookies at our office. And so, we love that because it's like they're still thinking about us. Or when my college kids who graduated like 10, 15 years ago from vision therapy still come in for their annual exams for no reason. I'm like, oh, thank you. I appreciate that. I love you guys. I like when they just come in to see me because, I'm their eye doctor, and that means that they've had a really good experience. And that's what we want them to have, because it's very easy after therapy for them to go back to whoever, not even go back, but it's very easy for them to go see somebody who's super fast, somebody who's not going to have a wait list, somebody who's going to be able to get them in same day, like a walk-in appointment, all of that. Like, that's just, especially in your 20s, like, why not? Who cares? Your eyes are fine now. They're fixed. I fixed them. And so you can go anywhere. And the fact that they're still coming back just shows the experience that they've had there. And so that's what we want to foster in our patients and the families that are coming to see us. That's what we want. And we want to create these experiences for them. And remember that families are coming in with their own chaos. The people, like, it's like, oh, kid just vomited in the car, like all these things. The parents are coming in just sometimes at their wits' end. And we want to have this be a place where they can just relax. At our office, we had like a quiet room. So that was like a room where our parents could just go in, relax. We had like classical music playing. There was a fireplace. There were fresh baked cookies and gourmet coffee and everything. And they would lock the door. And we're like, hi, excuse us, can we come in? And they're just like making sure it's not kids. I'm like, no. You can't lock the door in my office, but thank you. But it's like parents just need that moment. And we want to make sure that we're providing them space to just feel calm and not have that chaos, because they're going to arrive anxious. Maybe they just got into a fight with whomever, maybe the children aren't doing well in school. Maybe, this person like rear-ended them or whatever's happening. Like, things happen in life, and we just want our offices and our stability to make people feel really held and safe and calm. And this is like a place that they want to be, because at our offices, people are coming in all the time. And we don't want it to be a place that they don't want to come, because then they will stop coming and then they will not tell their friends to come. So this is one of the many things that, we really need to look at as practice owners. And it's very, very hard to step back and think about all those things when we are juggling all the balls and we are trying to make sure that none of the balls are dropping. And we really want to have that moment and that space to clean everything up. But last I checked, there wasn't an 8th day of the week. And so how do we create this space? How do we create this moment? And the way that we do that is by changing our structure and our model. That's the only option. We cannot clone ourselves yet. Maybe it's coming. Who knows? But it's not here right now. And so we need to figure out another way. And so chaos doesn't mean that you're failing at all by any stretch of the imagination. It means that your practice is really, really busy. And that's really, really great. But we need to make sure that the structure and the model can support it. So it's something that's diagnosable, it's predictable, and it's also fixable. So with that, I wanted to re-invite you to the Refocus and Reset Challenge that we have kicking off January 6th at 12 p.m. In that challenge, that gives you the space. We need you to take away, like step away from your practice for 1 hour a day for 5 days. You can do it. I have faith in you. That 5 hours that you dedicate to really stepping back from your practice in this structured way, having this structured reset where we are going to dive into everything going on in your practice. We're going to be looking at your conversion rates. We're going to be looking at where the chaos is leaking out. We're going to look at your leadership skills. We're going to look at your team. We're going to look at your models. We're going to look at all of it so that you can start 2026 off strong and powerful and ready to go. And so with that, the link is below, and I would love to see you there at the challenge. Have a great day. Enjoy the snow.